Thank you, Carolyn, and thank you everybody who's here. We were very fortunate to have Patty talk to us beforehand. She really laid some great groundwork for us. One of the things I think that's really important that Carolyn mentioned is that I've been involved since the first grant that was approved is when the CIL got involved just before that. And if I really think about it, my involvement with the university goes back to 1978. And at that time was when I was diagnosed with diabetes. And that is when I first became involved with the community of the University of Michigan formally. Prior to that, you know, the connection to U of M that we had was that my grandfather went to law school here, and that was back in, you know, the early 1900s. So, and then had not been back to the university since. And so that was the positive of finding out that you have the diagnosis and then being able to come to such a great institution for your care. And so with that, though, there are lots of experiences that people have when they have different disabilities. Carolyn already did make the disclosure that I'm both a community member and a staff member here, and while I'm not encouraging everybody to necessarily use the CIL, you should know that it's a resource for all of your community members that you're working with in your practices, and that and as we go through here, you'll hear more about how the CIL is involved in different places. The next piece I'd just like to show you is a quick clip, and then I'm going to tell you a little bit more about me after that. So basically, they do a little bit more character joking with that for a second. We're just going to go to the next slide, and I'll talk about what was happening in there before we talk about the slide. But one of the things that's really important to note in there is that there was this very narrow vision that they were seeing. Anybody want to say something that they thought was like really stood out for them in that clip? Right. Right. So there was something that was really obvious in front of them, but instead of saying that that was what they saw, they didn't share it. But there is so much more depth to people besides what you can see or not see related to disability. The last talk that we just had was really about mental health, and there'll be a slide later in my presentation where we'll look at that as a secondary condition of people with disabilities. But the important part is that there is stigma attached to all different kinds of forms of disability. And what we really work for in the Center for Independent Living is at breaking that down. And that's what we also do as people who happen to have disabilities. So I already shared with you that I have diabetes. And so I actually ended up choosing to come to the University of Michigan. It had nothing to do with my grandfather, had nothing to do with the wonderful Dr. Bob Kelch, who was my endocrinologist when I was younger. It had to do with all the great things that I thought I could do here at the university. And fortunately for me, I was here for a couple of years before my next disability decided to raise its head in my environment. And so now if you were to see me, and you see me, you see me walking with a cane, really what is different about me as a person? Anybody?
Visual impairment.
You see the visual impairment, but what's different about me? Absolutely nothing. And that's true of every single patient that you work with, every single subject that is in your research studies. You need to see somebody as a whole person, and what is about that person besides that particular research issue that you're looking at. Because the whole rest of that person and that person's relationships that they have all impact how they participate and how they take care of themselves health-wise, or how they follow what your research guidelines are. And we really need to be looking at the whole person. And so, you know, most of you have seen me here in the building today. Many of you have worked with me in other places. And depending on what the situation is, you wouldn't see my cane. Now, last night I had to come back to Rackham because I left something here. And when I came, I had to come into this room, which was dark at the time, and I believe it was Christina that was helping me at that time to make sure what I was getting was mine, because I couldn't tell in the lighting what was what. And there were a few other things that were left behind yesterday, I guess, by other people. And then when I went to leave, I needed to make sure that I didn't go down the steps, because I didn't have my cane in my hand. But while I was in the building, for just those few minutes, the lighting had changed outside. And so that's what affects my personal piece. Transportation affects my personal piece. Different people with different disabilities have different experiences that they will have and bring to the table. And just like the talk last night, many people in the community have many types of assets that they can bring to the table, and we need to be looking at that very broadly. As you see on this slide, it's talking about the definition of disability, and this is what the ADA has declared their definition of disability. It's one of three things. It's either a person who has significant limitations, whether they be physical or emotional, or access issues into whatever environment or program that they could be in to complete their activities of daily living. The second one is if you have a record of having a disability. So if you're a person who has recovered from cancer, or a person who is in recovery from depression, and people are treating you differently as such, or you need accommodations because of that previous disability experience, then you're also covered by the ADA. And then finally, if you're the person who's caring for somebody who has the disability, then you become a protected class within the ADA. So there's really a lot of ways that people with disabilities are affected in our community. So who could have a disability? I picked this up, and the reason that I have this is I don't have quite as fancy PowerPoint skills as Tom did last night, where things were popping in and out. But you see that it's basically the relationships that you have in your community. You have your friend, your neighbor, your relatives, your colleagues, and then, of course, you. And here in the room, if there's about 100 people here, then the expectation, or not the expectation, the results would likely show about 20 of us in the room have at least one disability. And it may be something major or maybe something minor, but it has some connection to disability. And we are the largest minority. If you took all the people with disabilities, we are bigger than any single minority group. But every single minority group is represented in the pool of people with disabilities. There isn't any particular disability that people can maybe not get because of who they are. There are all different ways that people have in their genes, have by accidents, have by relationships, all kinds of different things that can be the ways that people become a person with disability. It can be from birth, et cetera. And so we just want to be framing that as we're talking. And so when you want to go and look at where are you going to get your population from for your different studies, you really sometimes don't have to look very far beyond yourself, and you will find ways of being connected. And also that was something that Patty was sharing, that when we talk and see what drives people to be involved, just again, speaking for just a second about myself, I've always had a passion for justice and social issues, even before I ever thought I was going to go to school. Then because of my vision impairment, I had decided that I was scared to go to medical school because I was worried that I would lose my sight before finishing, and then I'd have this huge bill, no degree, and no income. And so how was I going to do that? And so one of the things that was very interesting to me was social work, because I could still work with people one-on-one, I could still work towards social change, et cetera. And so that's where you hear my passion coming out. It happens to be today that you're hearing my passion about disability. Tomorrow it could be my passion about something in the community, or something to my kids, or something for transportation, et cetera, because that's just who I am. There's a lot of vigor in me, as I guess my mom likes to say. She has a hard time sometimes steering where that vigor is going to go. But really, the other piece of it is that on the slide, I'm saying there's more than 50 million. Why did I put that number? Because some of you are going to say to me, well, this census says 52.7, and that one says 53, and this study says 54, and that one says 44. It depends how they're counting it. Either way that you look at it, there are many, many, many people. At least what we say is about close to 54 million, but I went with the lower number so we aren't exaggerating in this particular description, and that acquisition of the disability can happen at any time. And that's why we need to be prepared and knowing that what we do could at any time be different. It's different when our children have an illness. It's different if we have an illness. It's different if a spouse has an illness. We experience disability in different ways. If our coworkers are having experiences, et cetera. So we need to be more open and willing to work with different people. In 2007, the Center for Independent Living did a study that was repetitive of a community study. There was a community study that looked at 55 different indicators of the community, and one of the categories that was not listed anywhere in the study was, were you a person who had a disability? And so two individuals at our office began to think about how could we replicate that study. And so what happened is that that study, I think, looked at 175 individuals in the Washtenaw County area. A third of them were people who were political stakeholders. A third of them were mental health, physical health providers of care, and a third of them were some community members just randomly picked from, I'm not sure, I don't remember at the moment, so I don't want to misquote where those community members came from. And what the center did is we picked 100, I don't know how we came to the number 137, somehow we got to some statistical value and we got 137 people who had had services that were in our database to sort of replicate a mirrored study. And these were different people with all kinds of disabilities who were asked some similar questions. And the results that came back were quite informative. And in fact, what we did do at that point is there was an organization who did that United Way study, statistical analysis. So we knew what we saw was there, but what we wanted to make sure is that we were looking at exactly the same way that United Way's analysts had been looking at it. So we hired those same analysts to look at our data. And here's just an example. We're just using available health care as one piece of what is the importance and what is the resources that are out there. And so when we look at the study, the yellow on this, excuse me for one second.